Welcome everyone, my name is Melinda Antal, and in my thesis I would like to discuss the optical and mechanical properties of dental ceramics. Allow me to introduce myself quickly. I'm a fifth-year dental student and a first-year PhD student here at Semmelweis University. My vision is to provide patients the best all-ceramic restoration, and my mission in this would be to supply dentists a guidance about the appliance of different dental ceramics. I have two specific goals for now, which are strongly connected to each other since both of them investigate a dental ceramic called zirconium dioxide, or shortly zirconia. In my first project, I would like to compare the mechanical properties of additively versus subtractively manufactured dental ceramics with the methodology of a systematic review and meta-analysis. Over the past 35 years, CAD/CAM has become an increasingly useful technology in dentistry. It basically allows you to produce all ceramic restorations even in your own dental office. When talking about this method, the manufacturing is mostly milling. Milling, or subtractive manufacturing, is widely available, but it has big flaws, like wasting a lot of raw material that cannot be recycled and causing the wear of the milling tool, so overall it is expensive. Recently, a new method, printing or additive manufacturing, has emerged in literature. Printing is basically building objects layer upon layer. There are many available techniques, but the two most popular ones are stereolithography and direct light processing, both based on photopolymerization. Printing has big potential because it could overcome the disadvantages of milling, like almost wasting no material, creating complex geometries even with the finest details, and building multiple objects at the same time, so it is a really cost and time effective method. But whenever a new material is produced, mechanical properties are really important to consider. When we want to see if printed materials can overcome milled materials, we have to be sure that they are at least as strong as milled materials. And the best property to evaluate would be flexural strength, because it helps to predict the performance of a restoration. This is why my aim would be comparing the mechanical properties of additively versus subtractively manufactured dental ceramics. This leads me to my clinical question. Do mechanical properties of dental ceramics differ when produced with additive versus subtractive CAD/CAM manufacturing? My population is dental zirconia. I would like to compare additive with subtractive manufacturing. My primary outcome would be flexural strength, and my additional outcomes would be Wicker's microhardness and Weibull characteristics. I hypothesize that additively and subtractively manufactured dental ceramics have similar mechanical properties. My implication would be to provide patients better and cheaper restorations. Here you can see the details of my systematic search that I conducted in 4 databases, and after the selection process, I ended up with 308 included articles. Here you can see the list of my ongoing and finished analysis, and on the upcoming slides, I would like to show you my partial results for 3-point bending strength. So 3-point bending strength is basically flexural strength measured with 3-point bending test. And as I said, flexural strength is really important for a dentist because it helps to predict the performance of a restoration. The unit is in megapascals, and for dental zirconia, it is usually above 800. Here you can see the finished results for our 2-armed studies. We included 8 in vitro studies that had the same weight on the outcome. You can't unsee the big heterogeneity, which is due to the fact that these articles use different brands of zirconia and different printing methods, as you can see in the comments section. We are working with mean difference. If the article is on your right, then the milled material was stronger in the study, and if it's on your left, then the printed was the stronger. We have an overall mean difference of 180 megapascals. And although we believe that this is clinically relevant, it hasn't reached mathematical significance yet, suggesting that printed materials are as strong as milled materials. And although printed materials have come a long way and are really close to milled materials, we still think that they cannot be used in the same indications yet, and that there's still room for improvement. We also included many one-armed studies as well. Here, instead of mean difference, we are working with pooled means. We did subgroup analysis based on the yttria content of zirconia. Zirconia usually has 3 to 5% yttria in it, and to put it simple, the more the yttria, the better the aesthetics, but the weaker the material. Looking at each subgroup, we can see the recently mentioned pattern, which is already well known in literature. With 3% yttria content, we get an overall flexural strength of over 850 megapascals. With 4%, it is only 680 megapascals, and with 5%, it decreases to 470 megapascals. Looking at printed zirconia, we can see the same pattern, with the only difference that we haven't found 4% yttria stabilized zirconia available to printing. So with 5% yttria, the overall flexural strength is above 800 megapascals, and with 5%, it decreases to 646 megapascals. What is really interesting is that if you look at the 5% yttria stabilized zirconia in the printed group, the flexural strength is really similar as the 4% yttria stabilized zirconia in the milled group, suggesting that with 5% yttria stabilized printed zirconia, we can get really good aesthetical results without compromising for lower flexural strength. Still looking at printed zirconia with its subgroup analysis based on the printing method as well, here I want to show you the results for the two most popular techniques, direct light processing and stereolithography. Direct light processed zirconia has an overall flexural strength of 553 megapascals, and SLA-produced zirconia has an overall flexural strength above 850 megapascals, suggesting that DLP-produced zirconia cannot be used in the same indications as SLA-produced zirconia, and that stereolithography is a really promising technique which could give us zirconia with the same or similar flexural strength as milled zirconia. The strength of our project is that many of our studies use a standardized methods for flexural strength testing, and we will include every flexural strength available. And we also included many one-arm studies next to the two-arm ones. But the limitations are that these studies mostly use different brands of zirconia, different manufacturing techniques, and different specimens dimensions sometimes. Here you can see the progress regarding my first project, and allow me to move on to my second topic, which investigates the effect of material aging on the color stability of dental ceramics, also with the method of a systematic review and meta-analysis. So the introduction of improved materials and fabrication technique changed the aesthetic restorative treatment patterns and resulted in a higher demand for aesthetics in dentistry. This led to the worldwide spreading of all ceramic restorations which can successfully mimic dental structures. Zirconia is one amongst the most popular dental ceramics. It has excellent mechanical properties, and with the introduction of more translucent versions, they can be applied in the anterior region as well. But whenever we place dental zirconia into the harsh environment of the oral cavity, it ages just like every other material. And aging can affect color. And since patients care mostly about appearance, color stability is a crucial factor throughout the functional lifetime of a restoration. This is why my aim is to investigate the color stability of dental zirconia. This leads me to my clinical question. Does aging of dental zirconia affect its color stability in vitro? My population is dental zirconia again. I would like to investigate thermocycling, mechanical and chemical aging, and compare it to the material before the aging process, and my outcome would be color difference. I hypothesize that the aging of dental zirconia does not affect its color stability in vitro. My implication would be to provide patients with long-term aesthetical restoration. Here you can see the list of my ongoing projects investigating the mechanical and optical properties of dental zirconia. And allow me to thank you for your attention with my favorite quote from opera: "Failure is a great teacher, and if you are open to it, every mistake has a lesson to offer." Thank you so much.
Based on your result, there is a big difference in the mechanical properties in the additive technology, that it was made by an SLA technique or it's a DLP technique. But what do you think? What can cause this difference? Is the difference in the technology, or why the SLA is much better than the DLP technology?
Thank you for your question. This is also a mystery still for us. I think that because SLA uses a really tightly focused laser beam and is really precise, maybe this can lead to really good mechanical properties, and it is a novel technique which is often used, so maybe it improved better than DLP, but I have no concrete answer for that yet, but I will look into it because it is really interesting that they have such big difference.
As a scientist, what would you suggest us, based on your results as a clinicians, what should we do in a clinical practice?
Thank you for your question. In clinical practice, I would use printed zirconia for long-term temporary restorations, and after they are improving much better and are on the same level or are better than milled zirconia, we can use them as definite restorations.
If I want to make a 3D printed crown, for example, tomorrow for my patient, a 3D printed zirconia crown, can I make it?
Depends on where you are in the world.
In Europe.
In Europe, not yet. It is so dental printed zirconia is not yet available in Europe. It is really novel. It is really new. So it is mostly available in the United States and some part in Asia. So not yet in Europe. But I hope that this will change in the upcoming years.
Just few kind of recommendations that are more general in nature than strictly related to your work. So when we state that hypothesis is that something is not different, that would be a null hypothesis. Research hypothesis would be that there would be differences among evaluated parameters. Well, this is in part statistical analysis, so null hypothesis may survive. In general, also, and I serve as editor-in-chief of Journal of Aesthetic and Restorative Dentistry, so only last year I got 743 papers, and what is common, kind of, it's not a mistake, it's just, it can be better. Number of decimals when you guys are rounding, so 643.35 means nothing, those 35. There is something that's called significant figures, which is available online, and there are rules, that's one of methods, of course. There are rules on how to round, actually, to how many decimals. Well, 0.02, yeah, it makes sense to have 2 decimals, but 643, not really. And it's, again, it's not personal, it's just general. You'll have like 9 presentations here. Thank you.
Thank you so much for your recommendation.